Nocturia or getting up multiple times at night is a common phenomenon. Unfortunately, it hits us at that age when we're not expecting it. In other words, in mature ages beyond 50s, 60s, 70s, and 80s, when we are in our different age group altogether, we suddenly find we're getting up multiple times at night. It's nice to be knowing this because nocturia is unfortunately a disease of elderly. It's a disease which is very silently kept, concealed by people around who don't complain much. Nocturia is all about getting up multiple times at night to pass urine. So, what happens at that age group? On one side, elderly people have got milder sleep, lesser sleep. They sleep lesser number of hours, and the sleep also is very mild. That means our fathers, our grandfathers, our mothers, and grandmothers have a milder sleep. But it can happen to our age group too, late 40s, 50s, on one side. On the other side, elderly people have more urine production. So urine production happens from the kidneys, and that doesn't require your appointment, that doesn't require your permission. Kidneys produce more urine at night. In elderly people is known. Why? It's all because of arginine vasopressin system and the circadian rhythm of the kidneys functioning on the hormones have gone wrong. It goes very progressively wrong, and people in their 60s, 70s, 80s, and 90s get up multiple times at night to pass urine. Nocturia is a difficult phenomena to treat because, first of all, it is quite hidden and concealed. People don't report about it. When they've reported about it, patients have got treated for prostate issues because prostate is simultaneously growing or enlarging or obstructing. And men complain of prostate issues, women complain of other issues, perimenopausal and postmenopausal. And somehow the entire thing is shrouded in unfortunate secrecy, unfortunate incapabilities, unfortunate happenings, which probably has not helped the whole cause of nocturia. So, nighttime urinary symptoms is completely another ballgame, which has not been in the domain of doctors and patients too. Patients sometimes complain and doctors miss it out or probably would leave it alone saying that you drink too much of water at night. So friends, nocturia or getting up multiple times at night can hit anybody. If you get up 3, 5 times at night, what happens to you? You're almost sleepless the whole night. You cannot get that sleep and the recovery and the regeneration which body requires for the sleep. And the sleep revolution, therefore, is disturbed. And once that is disturbed, you're not in shape right now to be able to be great in the morning time at your work, at your desk. The concentration part is minimal, the irritation part is high. You're not your best in terms of your capabilities in the daytime. So, friends, getting up multiple times at night to pass urine or nocturia is a disease process. It is something which can be treated and cured. At the Kokila Dhirubhai Ambani Hospital, I take passion on the subject on nocturia and bedwetting because this is something which we launched as a clinic 7 years ago at the hospital. And on one of the YouTube videos, when you find nocturia and bedwetting that I've spoken on, I've spoken loud and clear to close to 600 people at the launch of this nocturia bedwetting clinic. In other words, nocturia or getting up multiple times at night can happen because of multiple reasons. The commonest reason could be they're busy drinking too much at night. Tea, coffee, alcohol work as diuretics and produce more urine at night. Drinking too much of water and milk at night is all about the urine will anyway be produced even if you don't drink too much. So the first thing is cut down your beverages, water intake, tea, coffee, alcohol at night so that you are in a better shape in the discipline that the body demands in terms of the milder sleep continues and you rejuvenate and recover. Sleep is not so deep in elderly people around. They're already waiting and tossing in bed to get up. And on our side, we're busy producing urine as a result of beverages. So why do Indian men drink milk at night? Milk can be taken in the daytime too. The thought process is milk will probably give them energy and good sleep, which is not true. Milk is another nutrient which is obviously required by one and all and should be taken best in the daytime. So suggestions here are that we need to look at cutting down our beverages if we have nocturia or nocturnal polyuria. We produce more urine at night. The disease processes which cause more urine at night are diabetes insipidus, diabetes mellitus, cardiac issues, people taking diuretics, estrogen deficiencies. All these issues around do cause as generalized issues which cause nocturia or getting up multiple times at night. Urological diseases, for example, a prostate issue which can cause bladder to be secondarily overactive, number one, at that age when already nocturnal polyuria or production of urine is more at night, troubles you so much. So I think it's important for us to come and complain to our urologist that I have got nocturia or I get up multiple times at night, even after I don't drink water. That's true. A lot of people whom we actually give into behavioral therapy apart from medical management and watching them very closely on other aspects, tell them to cut down their beverages, water intakes, liquids after 7, 8 in the night. We have medicines to actually make a whole change and gamut of the nighttime urinary symptoms. But the first thing is a discipline, a self-discipline, and a quality of life, which individuals embrace when they come across this table and we look at nocturia as a bothersome symptom. Nocturia or getting up multiple times at night. is a trouble which doesn't let you do well. So are you getting up 3 times at night or 5 times at night? So what is normal? Normal is 1 to 2 times. You will be getting 1 to 2 times at night. Again, is related to the amount of production, amount of stimulus and a deep stimulus which wakes you up, or you are partly awake and you probably get up. So this can happen once at night in your 40s, 50s. It can happen once to twice at night in your 50s, 60s. But beyond that is not regarded as normal. Therefore, there are changes that we can make as individuals in society to cut down our nocturia and nocturnal polyuria, and therefore the production of urine at night can be brought down by your own self-help. Other things, a urologist is going to do it for you. So it is important for us to identify the causes of nocturia first, and the causes can be legion. There can be many. On the one side, there are urological diseases. Other side, there are generalized diseases. As I said, everything from diabetes insipidus to diabetes mellitus to congestive cardiac issues, to estrogen deficiency, to just the sleep patterns. You're awake whole night. Just primary polydipsia, drinking too much of water at night. So look into this because it ruins your quality of life, and it is day after day. You're irritable and not the best performer in the daytime. And nighttime is all about trouble. Nighttime is about you getting a multiple times and probably missing it out. So there is a treatment. Once nocturia has been picked up, we go to the definition of nocturnal polyuria. That means polyuria is more urine production, and more urine production at night is again calculated by various rhythms. We look at it. There are medications to treat you and probably get you back to where you belong. So it's important for us to identify nocturia or getting up multiple times at night. If I have one, I would like to see my urologist. At the Coquitlam Hospital, nocturia is a passion to me as a quality of life issue, as much as bedwetting in children. Children continue to bedwet between the age of 6 to 15 years, and parents probably miss it out and forget or think that because the elder sibling or because I was bedwetting in my childhood and got dry, this child will also get dry, which is not true. Many bedwetting children are of the age of 15, 16, 17 years and have to go to the hostel and still are bedwetting and are scared to go to the hostel to live in those locations around. Many children or girl child at the age of 20, 25 is still bedwetting once, twice a week, once, twice a month. And that's too much of an embarrassment for her to go out and probably get into bondage and issues that actually matter around. So nighttime urinary symptoms have been missed out by the society, by all of us. We don't discuss too much. But remember, bedwetting is such an issue. If we don't correct it today, it may not always be self-corrected on its own as a result of milestone change. Similarly, on the other side, nocturia is something which is progressive. It progresses because of multiple reasons and requirements. People are thirsty at night. They want to drink more in the night. They want to drink less at night. Coffee and cafe coffee days and Starbucks around, and people love drinking all that beverages, which just produces kidney to produce more urine, bladder becomes more irritable. So I think quality of life issues get hugely disturbed in the very rhythm of life-threatening diseases and quality of life diseases. As a doctor, as a urologist, we all look into safeguarding this by an awareness and awakening of individuals where we all miss out. It's important for us to wake up to this phenomena that nocturia is such an important aspect. Over the last 7 years since we launched this clinic, thousands of individuals came and said, I don't have prostate issues. They don't have really. They did a uroflowmetry and the flow is very good. They're still very young, even if the prostate is large, big, enlarged, etc., etc. The PSs are normal. And they have been treated for prostate issues when they have nothing to do with the flow. The flow is good. The prostate may be getting enlarged as the age is changing. But the primary complaint of nocturia, men, women, elderly, parents, grandparents, is something which can be treated and cured. You got to look deep into it. This requires an interaction across the table, identifying those confounding factors and help individuals and society to have a better sleep. Sleep well tonight for a better morning is what we look forward to in this Nocturia attempt at Nocturia clinic at the Kokilam in Dhirubhai Ambani Hospital in the Department of Urology. Thank you so much.